Is there anything I can do to make my left cheek look like my right? I have noticed my two cheeks look completely different. I am not understanding why my left cheek looks like it's doing no work. Is it that my left cheek has less muscle? I am so confused. Please help.
Thank you for your question. You submitted your question with a single photo, and you're asking, is there a way to make your left cheek look like your right? And you've noticed that there is a difference between your cheeks, and you want to know, is it because the left cheek has less muscle? Well, I can certainly address your question, of course, in the absence of a physical exam, and give you some guidance as how I discuss this with my patients every day in my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, helping people address concerns about their facial symmetry is something that we do in our practice every day, and we provide the full range of solutions from minimally invasive non-surgical to complex surgeries. So I would say that your question is extremely common, and certainly the relevance now and the tools we have to help patients like you give us a lot of opportunity to make a difference. So let's understand some basic principles. One of the things that we notice in our practice with patients is that as we get older, or if there is any fluctuations of weight, it's very often becomes something that people notice is the difference in the volume in their cheeks. And I think it's very, very important. It's a commonly held understanding in our specialty that the area from the eyes that forms an inverted triangle to the chin includes the cheeks, and it's an area that really defines very much the impression of our facial expression. So if you have nice looking eyes, well sculpted cheeks, and a nice taper to your chin, that's considered very attractive. So when people see that their cheeks look relatively hollow, or one side looks more hollow than the other, it draws their attention. So to begin with, in our current understanding, it's really not so much the muscle as you had asked, but it's really actually the bone structure that is critically important when it comes to symmetry. When we think about everything else, the bone structure is like the foundation, it's the framework. And it is natural for all of us to have some asymmetry. There's always one side of the face that has more projection than the other. Now, as the soft tissue around in this area, whether it's the fat, muscle, skin, soft tissue, can decrease with aging or weight loss, that asymmetry that originates from the bone structure becomes more obvious. Now this leads us to a solution which I think is really significant and has been very effective for our patients, and that is a procedure called structural volumizing. Structural volumizing means that what we're using is actually long-lasting injectable fillers, such as Juvederm Ultra Plus and Juvederm Voluma, and we're actually placing it using a very specific technique on the bone structure, thereby addressing the underlying foundation that is responsible for this asymmetry. Now, I understand that you want to make the one side look exactly like the other, and in our practice we do strive to accomplish as close to as symmetric as is possible, and in a way that really it lends itself so well to the use of fillers. With fillers we can actually really sculpt. We can put subtle differences in the volume at this level to create balance. A lot of people are very much afraid of placing fillers in their cheeks because they see famous people who they feel have endless resources and end up not looking so good, a lot of times it's because the fillers are placed more superficially and placed just under the skin. And if the skin is in variable degrees of tautness, and it can just essentially look a little bit puffy and not desirable. When we do structural volumizing, it actually looks like the bone structure is naturally accentuated. It's a really, really nice way to do this, and it's been something that the feedback from our patients has been nothing short of very, very enthusiastic. So I think that that would be my my recommended option for someone like yourself in our practice. Again, this is in the absence of a physical exam, but I think it's worthwhile investigating and learning about this. So I hope that was helpful. I wish you the best of luck. Thank you for your question.